So I want to introduce our speaker. Chris Olsen is the GIS Chief Architect for Loma Linda University Health. He has transformed Loma Linda Health's enterprise GIS from a small department operation into a crucial and integral part of healthcare innovations in the hospital and clinics. And he also has been involved heavily in operations and asset management. His specialty among all these different responsibilities is indoor GIS and enterprise environments. Chris is a Iowa Hawkeye. He earned his BS there in geography, and he continued after he decided to move to Southern California and earned a GIS certificate at UC Riverside. Chris joined Esri in 2006 and worked for 12 years in technical support as a product engineer and in the mobile applications team prior to joining Loma Linda Health. Chris is a husband and father of 4 in Redlands. His wife, Lorraine, is present in the audience, and Chris is passionate about historical mapping and has done many mapping projects of old maps for Pittsburgh, Cleveland, Redlands, and even the University of Redlands. Chris is an Eagle Scout, and he serves as a Cub Master and den leader for his son's pack in Redlands. He loves to ski and travel with his family to national parks. It's with a great pleasure that we introduce Chris for this talk, and he's going to be talking about the exciting things that are going on that he's in charge of at Loma Linda Health.
Okay, start here. So thank you, University of Redlands, for having me here today, allowing me to show off some of the great projects that we've been doing at Loma Linda. A little background for Loma Linda University Health. We're located in the Inland Empire region of Southern California and operate 6 different hospitals, over 100 clinics throughout the region. Our coverage area stretches all the way from Los Angeles to Palm Springs, all the way from Las Vegas down to San Diego. We're the only level 1 trauma center in the region, and our newest building is the tallest hospital in California. We have 16,000 employees and over 1,000 providers within the university system. That includes 8 schools and 4,500 students from around the world. So Loma Linda Hospital was founded in 1905 by the Seventh-day Adventist Church and continues this day to focus on making man whole, physically, intellectually, emotionally, and spiritually. LUH has a long-term commitment to improving lives of our patients and to equip future doctors and nurses with the skills to improve people's lives. So how can spatial thinking help promote these core values? So our location services team at Loma Linda uses different GIS themes, and we focus on various areas around the hospital buildings and campus using indoor GIS as well as traditional GIS methods. This slide is kind of a high-level overview of some of the areas that we've been focusing in on or have current or ongoing projects with. So what are we invested in? For today's presentation, I want to focus in on 3 areas: patients, employees, and equipment or assets. For patients, we want to look at their experience in finding not only what building they have an appointment at, but also what hospital is it in. With employees, many of our departments have gone to a hybrid workspace or shared workspace with other teams. Logistically, how does this work with so many people coming in and out? Keep in mind that some of our employees travel a long way to come into the hospital every day. And last but not least are our assets. We invest millions of dollars in the latest equipment and facilities in order to promote patient care. What kind of ways can we keep track of these expensive items that we need to use every day for so many people? That answer is GIS. So traditionally, we think of GIS in outdoor spaces. We think of aerials, we think of rasters, we think of campus maps with nice little gray buildings on them, like the University of Redlands. We use things like GPS to find locations down to the millimeter and map different areas in outdoor technology. This next one is from a city in Colorado where they kind of break down what GIS is, and this is something that you've seen from Esri throughout the years: points, lines, and polygons. So that's great for a lot of things in the GIS world, but how does that work for hospitals? We do stuff inside. So we need to bring the GIS inside. Come on in. So how do we get there? What tools do we need? Well, we use things like, in our example, is ArcGIS Enterprise and ArcGIS Indoors, which we'll show some examples of. So I want to give a quick background on ArcGIS Indoors for people not familiar. This is a product from Esri that's been around for a few years now. It works in both their ArcGIS Online and ArcGIS Enterprise systems. It can be deployed rapidly. There's many different facets to it, most of which we'll actually talk about today, including wayfinding, the asset management, space management pieces, and things like that. So one of the goals with patient wayfinding is to make it easier for people to know where they can go. We developed some apps that make it help the customer with the ease of mind, and the patients be able to have less anxiety about coming into the hospital, coming to their appointments and everything like that. We actually developed a parking app that will tell you, as if you put in the building that you're looking for, it'll tell you what parking lot you can park at, depending on, you know, where in the building that is or what you may have access to. With Indoors, we can take that even further and bring them into the building and then take them to the correct elevator that they need to go to up to their appointment. And with that, we'll have a little demo. Okay, so let me do this. Okay. So this is one of our patient applications, and this is an app that can be deployed, you know, we see it through a browser, but you could also use it on a mobile device. This is built in JavaScript, so it's very flexible, going in different applications. This can actually even be deployed on kiosks throughout, you know, a hospital, an airport, or anything like that, to help people navigate wherever they need to go or to find more information about the buildings that they're in. So for instance, you can go over to the side here and you can hit explore. This will actually give you a menu of different things that you can quickly search for, like, for instance, the cafeteria. You can click on that. It'll tell you exactly. It might give you a list of different cafeterias, but in our case, we have one. You can curtail the actual pop-ups to have different types of media or information that you wanted to let the people know about. You can share this out. And because it's built on mobile, you can think of, if you think of like a kiosk, you can get this information. You could put your smartphone up right here and it'll pull up the map. And so you could start walking and wherever you need to go just directly from the app. But let's say, for instance, that we do have an appointment. Let's see if I can. So let's say that I have a peri-anesthesia surgical service that I need to go to. So I'm going to go to their guest lounge. And because we're using indoors, it switched automatically to the 3rd floor. So we know we're there. This is where our appointment is, and we want to get directions. So there's a couple of ways you can configure this. Because we're not there physically, I'm going to use the map, but you could essentially turn on your location on your device and be able to get a blue dot technology and be able to navigate wherever you need to go. Again, depending on which elevator and everything you wanted to go to. But for this reference, let's just say that we're in the parking lot and we're on P3, we're on level 1. And so it's automatically going to start building a route for us. So for instance, if we start at the parking level, it's going to have us move forward through the parking deck. And then it's going to tell us to turn into this grand hallway. We're going to pass by the information desk. And then we're going to go out into through the exit on that side of the building into entering the courtyard here. We'll go through the next building. We'll pass by the gift shop on the right. And then we'll pass by our security desk so you can get a badge to come in. And then you'll turn right. You'll go to the elevator. It tells you to go up to the 3rd floor. And then once you're there, it's basically just turning around and you're right at your appointment. So very easy to set up. And of course, this is just one building, and you can have multiple buildings throughout your campus. We actually went through 2 buildings to get there. But again, you could see how this could be confusing to patients that are coming in. And something like this makes it really simple for them to do. And it also frees up your staff from having to walk people around to the different appointments and help more people. So, all right. So I'm going to do this again. Duplicate. All right. Okay. Next thing I want to talk about is asset tracking. So one of the most important jobs of any business is knowing where your assets are. In the case of hospitals, there's machines and equipment that costs hundreds or thousands of dollars. It can be common for nurses or other staff to be territorial in the equipment that they use, and they want to make sure it's there when they need it. In the case of, say, an emergency department, having the proper equipment on hand is critical. This also applies to our dispatch team who oversees wheelchairs. Because as you know, people need wheelchairs when they get out of their car or when they get dropped off at the valet. They need to have these things on hand. So at Loma Linda, we've developed a system that tracks assets by the second and shows the latest known location of items. We call it Finder, and I'll do a quick demo for you. Up here in the upper corner, you see one of the little tracker devices. We use RFID technology throughout the building to be able to track these different things in real time. Okay. I'll just grab this one first. Okay, so this is our Finder app. And the people that are going to use this in the case of like a hospital system for us might be the charge nurses that are maybe in charge of a floor. And they're really responsible for their own equipment. So this nursing staff has a list of equipment that their department is responsible for, and they need to know where things are at. In the case of our dispatch team, like I said before, they are looking for wheelchairs, things like that can be rapidly deployed. So again, you can see we've got indoors turned on here. I'll go down to our first floor. And I've just kind of color coded our departments, but you could, facilitate the map any way you like. So, and just kind of show. So what we're looking at here, and it might be a little hard to tell on this one, but we'll go to a different floor here real quick. So you can kind of see these little circles throughout each of the floors. And these represent monitors that are on the ceilings of in the hallway. And so when we start to look at these assets, there's a little pie chart, and this will give you the actual number of assets that are close to this beacon. And these have about a 10 to 15 foot range. You could quickly just, if you wanted to see what was near here, you could click on here and get some information from the pop-up. We can see that there's 6 IV pumps. There's 9 ultrasound systems that are here, 6 telemetry receivers, and 1 that falls in the category of other. If you want to drill down even further, you can do that by clicking Browse Features. And here are the individual items themselves. So for instance, this one is one of our Bebron IV pumps. You can see the equipment details on it. And you can kind of see where it's near. So this is near the 6th floor, near this room. And the last time that the location was updated was about 10 days ago at 9:59 p.m. So as you can see, some things move around more than others. For instance, this IV pump has not moved since August. So as I said, each department is responsible for their items. This could be something that may be sitting in a supply closet somewhere, but the last known location was in this area. So the other way to search for items, and probably the main way that people look for things, is if they have, like I said, like the nurse, charge nurse would have a list of items that they're responsible for, or dispatch team knows the wheelchairs. So for instance, if we have a sheet that had all the numbers on it, we could look up each tag ID. And this is going to zoom right into which floor it's at. So this is one of our wheelchairs that we're looking for. And it looks like it's up on the 10th floor. And that was last updated probably about a week ago. So if you look at where it is, for our map would load here. This is actually near one of our closets. So this could be up near one of the elevators, or maybe just kind of sitting off by itself. So we'd want to, if we were on a dispatch team, we'd want to go up and get that and bring it back down to maybe our emergency department or something like that. Again, I'll grab another one. For instance, this is one of our perfuser pumps. And if I'm in charge of that and I need to know where it is, again, I'm going to type it into our finder. And I'm going to see that it's down here on our 2nd floor, which is near our emergency department. So we know exactly where things are. One of the other cool things that's come out of this that we didn't really think about or anticipate, because we launched this back in June of last year. And right now it's just in one building. So we have about 400 of these monitor stations throughout the hospital in this building, which is a 16-story building. But we're looking at expanding into other buildings and other areas, and including more assets to tag. Currently, we have about 4,000. We're looking to expand beyond that. So if you notice, one of our biggest circles right here of 332 items is right near a doorway to a bridge that goes across to the other hospital. So last known location was there before it went over to the other hospital. So we might have a case of things going missing, and we kind of know where they are, where they left, kind of thing. So All right. And back here. All right, that was my demo. So the last thing I want to talk about is some of the solutions that indoors can present. And when 2020 hit with COVID and everybody working remote, we were in the same way. Our IT department is about 400 people, and everyone started working remote. But we were very successful in this. And because of this, well, maybe other reasons too, but the company took away our space. So we had a nice floor in our building. Everybody had cubicles. Everybody was sharing information. But then COVID happened and they decided they needed more clinic space. So our space got taken away. But our managers gave us the option. They said you can stay remote or you can go hybrid. And almost 95% of our staff wanted to stay remote. But there's a few that like going to the hospital or into the office. They like the idea of going into an office. And of course, we have executives that need to go into the office every day. So they needed a space. So my one of the admins for our department was, without me knowing, was shopping around for kind of a hoteling space, a way to reserve desk systems and stuff like that. And then she kind of asked us in location services, well, you guys do GIS. Is that kind of like something that you could do? And the reservation system had just come out from indoors, and we said, yes, of course. And she asked, well, how much is it going to cost? Because she had had a quote from this third-party company of $1 million. And she asked how much it was for us, and I said it was free. I said, you're part of the enterprise system. This will take about a week to stand up, and we can get it going. And she was just floored that we could save the company $1 million by just using what we already have. So it's one of the nice things that we have a desk reservation system here. So this is just one of the examples. We've actually set it up in 3 different areas now for reservations. What you see on the right side here is our dashboard that I built for the admins so they can see who's in the building, when the upcoming reservations are. And because it's a dashboard, you can have any kind of analytics. You can see, what times people come in the most or what days. And all that goes into learning more about the facility and how people are using the system. So give you a little demo of that as well. It's going to make me sign in. So this may answer some questions that people have. Of course, with security, we work in a hospital, we have HIPAA data. Everything within enterprise can be configured for security reasons. And we actually use a lot of, within enterprise, you can set groups, you can do different permissions within those groups, as well as share it out to individual teams or even the department without things going public. So we actually have done in this building, they have different docking stations depending on, Macs or PCs or, different types of computers that you'd want to set up. And we're waiting a little bit for the maps to come in. There we go. So all of the kind of the tan desks are available. Looks like the one in red is the only one that there's somebody there right now. And then our executive offices, while they're technically part of the indoor system, the blue ones are not reservable. because that's where a lot of the admins or executives will sit. But let's just say, for instance, that I'm coming into this building and I wanted to pick this desk here. So of course I can get information on it, but I can also book it right here. And when I click book, it's going to bring up a schedule, and I can see when this desk is available. I have the hourly schedule. So if I want to just book it for an hour or 2 hours, I can do that. Or I can create an all-day booking. They'll just reserve it for whenever I want to come in. And I just click book. It asks me for the confirmation. And there you go. It's all booked. I can add this to my calendar so it can be sent to Outlook or Gmail or whatever you want it to do. And now that you see that it turns red because I booked it. I can go over and look at my bookings. So if I have, this desk reserved today, I could have another desk reserved tomorrow. All of these are because I've signed in, you see up on the right-hand side with my account. It's going to keep track of everything that I've booked. ArcGIS Indoors also allows for managers to be able to see this as well. So for an administrator, they could go in and see everyone who's done bookings so that, again, they can kind of plan out who's going to be in the building that day and kind of plan where those desk systems are going to be. Once I'm there, I can click check-in. That way my administrator knows that I'm there. And when I'm done, I can check out. If I wanted to, if I had a different space or maybe a bigger area, and I wanted to know what hotels were available, I could simply just run a search here, or I could maybe search on a different day and click find hotels, and it would basically break out a list of all the hotels or desks in this situation. But anything that's available for me to book is simply right there. And as administrator, I could go in and see all the ones that are already booked. All right. Do that. So there's the demo for that. So in conclusion, at Loma Linda University Health, we see the transformative power of what GIS Enterprise and ArcGIS Indoors can do for our systems. We've had years of implementation, and it's brought tremendous value to the organization, saving millions of dollars per year, as well as boosting the patient and employee experiences. We'll continue to push these systems further in healthcare and utilize GIS an integral part of our daily activities. So thank you. This is our main email address, GIS location services at lu.edu. And this is my personal email if you have any questions. Thank you.
Well, we're now open to, thank you very much. Great talk. We're now open to questions both online and in the room. And my colleague, Professor Abhijit Sarkar, will be taking these online questions, and our assistant will be bringing a mic to questions in the room. So please go right ahead.
Thanks, Chris. Great presentation. My name's Andrew. I'm from Esri. Question for you. I represent the higher education team, and I work closely with Loma Linda. I'm curious if there are any plans for use of the Indoors technology across the rest of the campus outside of the hospital. Obviously, you've got Building 125. And what about data separation for clinical space versus education space versus non-clinical administrative space?
Yeah, so we've actually talked with different departments that want to do this reservation system. We haven't implemented it yet, but I'll talk a little bit about, we've been in some talks with some of the doctors because, so one of the situations with the hospital is that doctors work a long shift. They may work 12 hours, 16 hours, 24 hours at a time. And so they actually have dedicated sleep rooms for these doctors to go into. And one of the unfortunate things about sleep rooms is that you may not know who's already in that room. And people have walked in on doctor sleeping. We don't want to have that. And so we've actually been in talks of developing this for, in this case, doctors, to have a reservation system for people to know, what doctor's in there, and then that it's occupied in general. So, but you could see there's a myriad of different things that, campus wide, if we don't use it directly, but I know with ArcGIS Indoors, there's ways to manage employees' systems, where professors are, within, their buildings and everything like that, and really just space management. We've had a lot of talks about that as well. Just knowing what spaces are occupied and unoccupied. In Loma Linda's case, we lease out to different doctors and different clinics and that kind of thing. And so there could be rent involved with the space that they have, and how does that calculate with the square footage? All these things are direct tie-ins to what ArcGIS Indoors can do.
Thank you, Chris. Great presentation. And I recently took my dad to Loma Linda quite often to see a cardiologist, and I experienced the difficulty of wayfinding over there because you have a new building and versus old building, both contained some parts of relate to cardiology. And so I wish I know this earlier. But I do have a question. So as from a patient perspective, so when I was searching on your website, for example, and I very often see a direction in terms of text description, and how you wayfind into that particular location. So I wonder if is that possible to insert a link of this app into all the departments' direction suggestion parts. And this is my first question. Second is, where do I find this great app? Should I need to download the app from my iPhone, or I can just get to that application through a link URL? Thank you.
So it's a great question. The display that I had was just running in a browser, but ArcGIS Indoors does have a native app for iOS and Android that you can download. So we've been working on that as well. It's not fully deployed yet, but that will be part of our future plans. The other thing would be working with our marketing department to promote the patient experience a little bit better that way. But the truth of the matter is that we're adding more buildings in as well to tie in with this. So, whether you're on the main campus or one of our clinics, you'll be able to use this app to, find the parking lot and then find the rooms that you need to go to. So it's still a little bit in progress, but that site is public. So I can provide the link later if you want to take a look at it. Yeah.
Let me make sure if this is, yeah, okay. Chris, 2 questions from a wonderful friend of ours, as well as Esri's Chief Medical Officer, Dr. Esti Garrity, who's been following the talk online. First question from Esti is, she says, well done. Can you please talk about the process of converting your floor plans to the Indoors data schema?
Okay. I was going to put a slide of that in there, but I didn't know how far into the weeds everyone wanted to get with this. So the one of the things that has made us successful in this is working directly with our lock and key and construction systems within Loma Linda, because you really need to start with a good base. In most cases with buildings, that's CAD data or BIM data. And so we've worked with them directly. And a colleague of mine has kind of taken it upon himself to learn GIS and learn more about it because he was our CAD expert. So he's really in the business of making sure that we have great data coming in, because anybody that's worked with CAD data before can know that it could be all over the place. Some CAD data is better than others. Some needs to be cleaned up. And I know that in his case, when he was going through and kind of preparing a lot of our buildings, he saw that because different companies provide different types of CAD. And so he had to go through and clean a lot of that up. And really that helps out a ton within getting the GIS set up, because the data is only going to be as good as what you can bring in. So having that set early and having that base, you can then convert using the ArcGIS tools, the geoprocessing tools in ArcGIS Pro to convert these CAD line work into points, lines, and polygons within GIS system. Esri has done a good job creating this indoors information model geodatabase that you can quickly convert the units and details and even employee records and everything into this system, and then be able to interact with it spatially and to deploy apps very quickly. So.
Second question from ST is, are there any plans to use ArcGIS indoors for infection control measures?
That has come up. It came up, I think, during COVID, actually, because of there's in Loma Linda and in other hospital systems, they tend to put COVID patients, in their own area and stuff like that. But I think what Esti's actually asking is, if we know an outbreak happens in one room, how does that affect other rooms? I would think that all lends itself very well to what indoors does, especially if you're talking about like patient tracking, knowing what patients were in what room. We didn't talk about it in here, but there's also tie-ins to our electronic health system record called Epic, which a lot of hospital systems use. So you could have patient tie-ins to the rooms that they were in and quickly bring those into GIS as well, and kind of do almost field mapping that way, and knowing who was where and for how long and that kind of thing. So, yeah.
Hello, I'm Carrie, and I'm from the School of Business as well. I didn't know if there was anyone else asking a question over there. With respect to the Blue Dot technology and integration within a hospital, did you have to do any remediation as far as interference with hospital equipment that is transmitting data, obviously? And then the second question deals with your asset management. How did you automate the incredible detail of information you have in your system? Were you able to scan UPC codes? Were you able to integrate between the asset itself and then adding it to your asset management system?
Yeah, great questions. I totally forgot the first one, but I'll answer the second one first then. For asset management, we actually work with some of the teams at Loma Linda to have a good system of record. So depending on what type of equipment it is, there could be different barcodes that are on it. There's barcodes that go back into like the 1960s on some of this equipment. And so they've done a good job of bringing everything in. We use a system called ServiceNow, which is our central system of record. And so within there, we can track all the different items. And the RFID tag is really just another piece of that. So the RFID tag has that number on it, and we can attach it to that system, and then be able to get more information about it, when it was last serviced and all that kind of stuff as well. Of course, there is a big undertaking because you're physically having to go through and tag all these different items. So there is, that part of it as well. And even within using the system for monitoring, if we go back and look, where to place these. So the company that we contracted with called Centrac, they'll deploy a team out that kind of looks at all the floor plans to know where their monitoring stations needs to go, so that it can be picked up and you don't have kind of holes, in the area. So that took a little back and forth as well. And of course, field testing and all that kind of stuff. What was the first question again?
It was concerning the deployment of your blue dot technologies and if there was any concerns with interference with
Oh, yes.
hospital equipment that is transmitting as well.
So one of the things that I didn't talk about that ArcGIS Indoors has, kind of a sister department to it, is called the IPS system, or ArcGIS IPS, I think it's called. And so you can actually do field mapping within there where your phone as a native app can either use Bluetooth or even Wi-Fi signals within the building to get that blue dot technology. So GIS technician would kind of preset that up. They would go through and walk the building to kind of calibrate where it is because of all the signals and stuff like that. Of course, with Wi-Fi, you're not going to have, as big a range. Bluetooth would be the best, kind of well, not necessarily the best, but the kind of the best lowest cost solution. And so you could have Bluetooth beacons throughout, and then as you travel, you'd be able to see that in real time as your phone moves along.
I have just turned on a couple of questions. One of your diagrams showed something in the ceiling that was creating those pie charts or feeding into those pie charts. I didn't quite understand what was happening with that. That's my first question, the technology. And then another question is, yeah, with that shared IT hotel space, so to speak, IT people like a lot of software. So I wondered, is a full panoply of software on each of those workstations, and how does that work?
Well, so the first one, the pie charts are just kind of just a way of symbology within ArcGIS. I mean, of course, you could just put the blue dot, or, it's a blue dot, but the dot on here with a number, but I thought it might be more relevant if, for instance, on this one, IV pumps are color coded in red. So we know that any of the red pie space, there's going to be more of those. And of course, with these, it's also scalable. So, 24 is bigger than 10. So you know that there's a lot more assets that are around there, and you can kind of quickly see where things are in real time. So that's all those are. It's just a symbology within the map. But these symbols sit on top of where those monitoring stations are. So if you know that these monitors that are in the ceiling, they have a range of about 12 to 15 feet in a circumference around them, you know that your asset is generally within that area. And sorry, what was the second question? Software. So in our case with the 125 building, they're just kind of more docking station setup. There's not actual physical computers there. Most of all of our IT people have their own laptops, and they have their own software built into there that just hook into the network.
Chris, just to build on Dr. Pick's question there. So I think what you're saying is that those receiving stations in the ceilings those are the RFID receivers, correct?
Yes.
Okay. And then the individual items are RFID tagged, right?
Those are the tags.
Okay. So 16 floors, right?
Yep.
Just curious, how many receiving stations do you have, along with how many Bluetooth beacons do you have in the hospital?
Well,
Rough numbers.
In this, so the monitoring stations that are here, the ones in the ceiling, is about 400. There's a little bit more to the technology. There's in this system, they use a kind of more of like a routing station called a star. There's about maybe 100 stars in the building. There's also a few timing stars. So timing stars will be able to make sure that everything's synced up within the, one building to another, or one floor to another in this case. So those stars will then talk to the monitors, which then talk to the tags underneath. So
And then are there separate Bluetooth beacons as well?
we don't use Bluetooth. It's
You're not
all,
using Bluetooth
it's all
beacons.
RFID.
Okay,
Yeah.
great. Thank you.
Chris, I have two more for you online and one more from ST. So I'll go to that first.
Too bad
Um,
Esty's not here. It would've been
I
great to
know.
see her, yeah.
I'm sure we will have her next time. In your asset tracking demo, if you were to find a lot of assets whose last known location was about to leave the building, did that information lead to any change in processes that would protect these assets from theft?
Not yet, but that is definitely something that we've talked about. We didn't know how, rampant the usage was kind of, in between the buildings. The new hospital building that I'm showing is really the primary location of where a lot of the appointments are and where a lot of the patients are. The vintage hospital that's next door that you see, and that a lot of people remember, is the 10-story building that was built in the 1960s. And still has a lot of outpatient clinics and that kind of thing. So some of this, equipment gets shared between the two. And as we expand, that will be the next building that we do. So a lot of the, quote unquote things leaving the building will be alleviated because we'll be able to see them, in the other building. But it does lead to interesting things, especially with like wheelchairs. I bring that up because that's one of the biggest things is that, we'll have wheelchairs not only leave the building, but they'll go to a parking lot. And then we won't see them for, a day or two until people bring them back. But there's things like that, these teams, we even worked with our kitchen team or our dispatch team in the kitchen, because they actually have these kitchen trays that will go around and deliver meals to the different rooms or to different sections. And they don't have very many of them, but they're important because once these meals are ready, they need to transport them. And so they're always looking, well, where did the kitchen cart go? Because so-and-so didn't bring it back. So there's a lot of examples like that, you may not think of traditional hospital equipment, but, as with any other building, these assets are vitally important to the departments that they're with. So, yeah.
Well, thank you for that detailed response. Maybe one last question, Jim. This is from Ben Cunningham. And Ben, I'm going to request if you could please state your affiliation and tell us where you're connecting from. But Ben's question is, how do you incorporate changes to floor plans when renovations happen?
So again, you got to have that relationship with your team that handles all of the CAD updates and that kind of thing. Esri's actually done a pretty good job of building a plugin now to AutoCAD that as these CAD updates come in, not only can you verify that these are going to be GIS ready CADs, but as the changes come in, you can quickly upload those and change those in the GIS system and then just quickly publish them out. So it's actually a pretty quick process in doing all that.
And the question was from the University of Virginia's Geospatial Engineering Services team. Thanks for answering.
Great. Thanks for joining.